if you ask the profession whether they could deal with another top-down reorganisation, you know, I think most people would just, there'll be a huge groan across the country. But I think if it's done in the right way, and you can actually do it with fairly minimal bill, actually a small bill, and this is what the NHS bill is at the moment, what we've heard about yesterday, the Pollock and Roderick bill that we're currently looking at, and we support that in principle. The National Health Action Party and a number of political parties like the Green Party support that. So it could be quite a small piece of legislation. But what you can do is by having a policy to make the NHS the preferred provider, you still keep your structures at the same time, but that kills the market in one go. Because if the NHS is the preferred provider, then that is, you know, fundamentally bashes the market straight away. But then you've got to change your funding mechanism, so you've got to get rid of payment by results. That'll be reasonably easy. The issue you've got, though, is you've still got all these CCGs up and down the country, all these organisations, but they can still be your planning structures, because the idea of commissioning, if it means planning of your local population's healthcare, that's great if it means planning. But what commissioning means at the moment is it's commissioning for a market. But actually, those structures could be used for actual planning purposes, and that's what I support, because I believe that healthcare needs to be planned carefully at local, regional and national level. That's what you need to do to deal with the variety and the epidemiology of disease that we see. So it's a very tricky question. We'd have to frame it very carefully and maybe use different language. Let's have bottom-up restoration of the NHS rather than top-down with a bit of legislation, and do it gradually over time.